Understanding the Human Papillomavirus, HPV. This patient resource was adapted by the Society of Canadian Colposcopists, SCC, with the permission of the BC Colposcopy Program. This patient resource was made possible through the support of Merck Canada, Inc. The opinions expressed in this material are those of the authors and do not necessarily reflect the views of Merck Canada, Inc. HPV is a common virus spread through sexual contact with or without intercourse. HPV can affect the vulva, vagina, and cervix, as well as the anus and perineal area, skin surrounding the anus. HPV is the most commonly sexually transmitted infection in Canada. About 75% of sexually active people in Canada will get the virus at some point in their lives. Although the risk is low, HPV infection can lead to the development of precancerous changes in affected cells. These changes can lead to an increased risk of cancer. HPV infection can also cause genital warts. There are over 100 different types of HPV. 15 of them are high-risk types that can cause precancerous changes and cancer. Low-risk types can cause genital warts but not cancer. HPV type 16 and 18 are high-risk HPV types that cause about 70% of all cervical cancers. HPV 6 and 11 are low-risk types that cause 90% of all genital warts. HPV infects cells that cover the inside and outside surfaces of the body, epithelial cells. This includes the skin, throat, anus, and genital tract. In most cases, your immune system recognizes infected cells and destroys them. If they are not destroyed, you can develop an ongoing infection. As infected cells grow, you can develop precancerous changes. Yes, HPV can cause cancer in both women and men. The most common cancer caused in HPV is cervical cancer in women and oropharyngeal cancer in men, cancer of the mouth or throat. Nearly 100% of cervical cancers are caused by HPV. Other cancers caused by HPV include vulvar cancer, cancer involving the skin outside the opening of the vagina, anal cancer, and penile cancer. Infections with high-risk types of HPV do not usually cause any symptoms. Genital warts may be the only sign in someone who is infected with low-risk HPV. In most cases, your body will get rid of the HPV infection without treatment within 1 to 2 years. However, HPV infection can persist. There is currently no cure or medical treatment for HPV. Although your body may be able to get rid of the virus, you can still become infected in the future. To see all the patient resources in this series, scan the QR code.